So many people they say that we need to normalize mental health, but the truth of the matter is it's been demonized for a long time.
1 out of every 5 adults, 1 out of every 6 kids is going to experience a mental health issue at some point in their lifetime.
If you want individuals in any community to achieve a better quality of life, you need the right mindset to combat addressing complex problems.
Community-based care, I believe, is going to be one of the most transformational things we can do.
ReCoup-New York is a really innovative approach that is needed all over the world. Our work with Problem Management Plus began a number of years ago in Nepal. Nepal's a country where there's only 1 mental health specialist for every 25,000 people. In a place like Nepal, Problem Management Plus helps to fill the gap. In New York City, we're testing to see if people who already have full-time, sometimes more than full-time responsibilities related to helping with social service benefits, doing job training, can integrate PM Plus into what they're doing.
You know, what I find so remarkable about ReCoup is that it involved community-based organizations, partnerships between the city government, between academic entities, and it was dedicated to ensuring that they actually measured the difference that they were making for people.
What we are seeing, and we have been seeing for a long time, is that there is a real accessibility issues, whether it is insurance coverage or it is having someone who is speaking the language of New Yorkers, and also capacity issue, because we know that there is a workforce issue.
I was very fortunate to be visiting the World Health Organization, and they told us about ways they were training trusted members of the community to deliver these brief, scalable mental health interventions built on the foundations of cognitive behavioral therapy. And we saw the data. It was safe, it was effective, and I began to wonder, why aren't we doing that in the US? Why are we not doing that in New York City?
During the period of COVID, there was this very serendipitous intersection by meeting Adam Brown at the New School, who was very interested in many of the same approaches and wanted to see, could we help bring Problem Management Plus and deliver it remotely?
What ReCoup did was it said, we have an ability to not just care for one another physically, but also emotionally, and ensure that we can help folks who were dealing with some of the most devastating consequences of the pandemic.
During COVID time, we know a lot of these community-based organizations or faith communities, they are telling us they saw that mental health challenges were intensifying. So this gap really kind of prompted us to bring ReCoup or Problem Management Plus into New York City.
For many communities, especially immigrant communities and other individuals where there might be a negative relationship in interaction with the mental health service field, they would like to be able to receive services that don't require a psychiatric label. So in that way, Problem Management Plus really fills the gap in being something delivered in the community for the community.
This is the first randomized control trial to evaluate the effectiveness, the cost effectiveness, and the safety of doing these interventions. I believe that this research is so important because we can engage in this dialogue through data.
Mental health support has taken the back seat for years, so certainly when we looked at the PM Plus program and the opportunity to partner to provide this to our community, this was one of the things that was the most exciting, that you would basically make these communities reach something that is almost unattainable to them.
We work with a lot of communities that don't usually have access to formal mental health care, or there's so many barriers to receiving it, whether it's like language, whether it's even ability, like mobility. I feel like ReCoup is a way that we can build that care in our own communities.
It's so incredible to see how like the connections that like community-based organizations have with their people. Like it matters so much in understanding how to care for them and understanding like what they need. The context is critical.
The ReCoup-NY project was just really interesting because It was getting into communities where you can empower people who are already providing other social services and like informal support with better skills.
We know that people who work at community-based organizations, who are working at our schools, who are working in places of faith, every day they are already supporting the social and emotional needs of people in their community. What task sharing does is it says, let's help support you to do that work by integrating evidence-based strategies into those interactions.
People naturally are able to support one another. So I think task sharing is just building upon some of those skills, strengthening some of those helping skills, so that community mental health or mental health becomes more accessible.
Something that I've seen while supervising people that are delivering PM+, they are finding that some of these people have never been asked or never talked about some of the problems that they're having in their day-to-day life. These are all the sites that we were implementing, and I supervised some of the sites, and there was a couple other supervisors that were also supervising the different sites. This is where Mixteca was, and Mixteca was my favorite.
Para nosotros, una de las dificultades a las que siempre nos hemos visto enfrentados es que la comunidad a veces siente los servicios de salud mental como un lujo. Y entonces por eso PM+ era como el complemento perfecto, porque era trabajar con ellos desde esos recursos que iban a ser usados pues no solo en las sesiones que vamos a tener acá, sino que luego ellos iban a llevar como en su caja de herramientas para luego usarlo con sus familias, con sus amigos.
If you have a toolkit that you can use to solve a problem, that will help you solve another problem, that will help you solve another problem, then maybe you can prevent falling into a pattern or a cycle.
PM Plus was an opportunity to be in alignment with what we do, to bring mental health support services to people at no cost. And we are trusted figures in our community, so people know that we're not going to bring them something that's going to harm them, things like that. So it was in alignment with what Live Redemption is about.
I think with a community center, a community-based organization like CPC, once you are able to provide a benefit service or a social service, the community members become a little bit more trusting and open in terms of these conversations. So I think that's kind of how we've model our outreach and just really having more in-depth conversations about mental health support.
There were some organizations who didn't have any mental health services or anything or connections at all, and participating in this project really helped them to kind of develop what is their mental health protocol.
El que ReCoup hiciera mancuerna o que hiciera equipo con Aid for Life, creo que era justo lo que faltaba y lo que necesitaba la organización para poder brindar también este servicio, porque si bien a lo mejor lo que hacía la organización era canalizar a otros lugares, pero ya con el apoyo de ReCoup, pues la organización misma tiene la oportunidad de brindar herramientas a las personas que están atravesando pues problemas emocionales o situaciones difíciles. Una clienta que venía con una ideación suicida al inicio de las sesiones. Al final de las sesiones nos arrojaba puntajes de 0, de 1. Entonces, a pesar de que EP+ es una intervención corta, se pudo ver un cambio notorio en esta persona.
After a few sessions and you started getting the responses, you felt different, you felt empowered, you felt like you were really gaining traction and you were making a difference in people's lives. I noticed that through food and conversation, you get a lot of things done. So I was able to hit a lot of great points, and get a lot of things done over pizza. So that was the running joke, that everyone was gonna come up from wherever they was and hang out with me in New York and get some pizza.
When you work with communities that are dealing with very complex situations, there is not a one-size-fits-all solution. And so the blessing of the PM+ program is that it's a tool that you can adapt to different resources, different capabilities.
The skills that you learn from the PM+, I would say it's like a reminder of being a human, I would say. Like in the training, they were teaching us to teach a skill, in every session. If I thought it was necessary to teach another skill, sometimes I was teaching them 2 skills.
I loved the fact that I could adapt it to the client based on their particular needs. There are some things that could be tweaked, which I did tweak, and that helped them to understand and to cope better with understanding the material.
If we're going to identify a cost-effective, scalable intervention, it has to include components that support a broader range of people. It needs to be inclusive. And so in a way, its power is in the fact that we've been able to distill some core strategies that promote positive coping that could impact a wide range of conditions.
When thinking about a program like Problem Management Plus that involves task sharing to people who are not clinicians, we often hear a lot of hesitation and concern. And so a crucial aspect of what we've been doing is integrating a competency-based training approach, which actually evaluates how well people acquire different skills. And from that, we can determine when they're safely able to deliver this intervention.
We all believe that PM Plus is a really good beginning because you don't need a license, you don't need a certification. But as long as you go through the training and under supervision, you can start guiding people to facing their challenging and found a way out. I think that's most important.
Being able to learn these techniques and these strategies for somebody who is just working at a community-based organization like PUTS is wonderful because you have the opportunity to help your clients at a different level. Not only the day-to-day situations that is going on, you have the tools to assess and to know like, okay, this person would be great to implement this program.
El proceso de entrenamiento sí fue un poco demandante en cuanto pues el tiempo, pues todo el proceso de entrenamiento, luego el proceso de supervisión, pero pues igual fue muy fructífero y sentíamos como valía la pena todo este tiempo que estábamos invirtiendo para luego usar esas herramientas pues con la comunidad.
I think as a helper, it was a little challenging at first, but I think after getting to understand the flow and had a sort of a cadence, I realized that it was easy for it to become a part of who I was and the structure that I had. We saw a large intensity of people becoming very positive after completing the program.
Over the course of our work, we have partnered with over 35 community-based organizations in New York City. These organizations serve the entire diversity of New York City across 3 languages, English, Spanish, and Chinese.
Muchas veces las mismas personas me dicen, yo ya iba al hospital a terapia con una psicóloga, me ponen un traductor, entonces hay 3 personas y no me siento cómodo contándole al traductor y luego él decirle a la psicóloga y luego la psicóloga decirle a él y luego él a mí y se pierde la comunicación.
Cuando yo llegué aquí tenía yo problemas de ansiedad, mucha ansiedad, tenía yo fases de nervios, estaba yo muy mal. Y gracias a este programa vine a todas mis sesiones y me siento muy bien. Estoy trabajando bien y se puede decir que tengo una vida normal.
Ya cuando me siento como más tranquila voy y veo, ¿no? ¿Qué solución le podemos dar?
Es más importante en ese momento reconocer nuestros problemas y cuáles están en nuestro control y cuáles no.
Mucha gente piensa que venir a una terapia es porque está loco, pero no es eso. A veces uno lo necesita. Como en ese tiempo yo perdí a mi esposo, entonces me sirvieron mucho. Podía hablar, desahogarme, sí, decir lo que estaba pasando porque tenía como 2 o 3 meses de haber muerto mi esposo. Estamos progresando con lo que tú nos enseñaste, estamos progresando. Claro que sí, vamos a progresar.
You know, in communities where PM Plus is being implemented, we really observe sort of an increased cohesion between the clients and the helpers themselves.
So we're transforming 2 people's lives here, those that are delivering PM Plus and those that are receiving PM Plus.
Knowing it is one thing, but you going through it as a helper, for example, when you're trained, it kind of helps you take the skills and use them for your own personal challenges or own personal things. The breathing exercise, it's it's something you can do anytime, anywhere, and has been really helpful to the people I was a helper to and the people we trained during the trainings.
What we know is with PM Plus, when we are able to have these support to adults, and they are the caregivers, their parent, their maybe older siblings, and even teachers, and they are experiencing stress, and when they're able to kind of manage their own stress and really support their own mental health, that could be a ripple effect for their own family, for their own lives, and also for the community.
There are even past clients now who are teaching their family members and their friends the technique, for instance, of stress management, to breathe. And one of the highlights of the program, as we hosted it here at Choose Life International, is that the clients were the ones who recommended others.
The trainers, they would say, like, I honestly don't know how to approach this particular problem. Does anybody else know and could give me advice? And so that again facilitated community building.
When you do work and you see that this same work is expanded to different cultures, like, whoa, okay, you're doing this in Chinatown, you're doing this over here. You know, I didn't think you would have the same struggles I would have. You know what I mean? But your care and concern is the same way.
It's really urgent to explore programs like Problem Management Plus right now in the United States. If you look back over the past 30 years, we've actually done quite a good job at reducing heart disease, metabolic diseases, deaths from cancer. But since 1990, we've seen almost no change in the impact on mental health.
I think that there is great potential for programs like PM Plus to expand. I also think that it will help kind of bridge the gap so that the mayor's office, state offices are just a bit more informed about what's going on the ground and what these different organizations actually need.
If it can expand indefinitely, that's a resource for people who need it. You know, a resource and tools given into the hands of people who will really do the work.
Wow, a world with mental health access is a holistic world.
What funders and policymakers should know is that this is making sure that we can prevent a mental health crisis before it can even happen.
And so the next step is we need to have innovation always on mental health infrastructure that can meet people where they are in their own communities, in their own languages, and at a time where it can make the greatest difference. But it starts with leaders recognizing the power of this approach and saying, we need more of this and we need it sooner rather than later.
Even though we've been working with ReCoup for 5 years, to know that it doesn't end here, you know, there's a lot more we can do for New York City communities.
And if anything, in these 5 years, we learned how powerful it can be when we create systems of support to address all of these needs in the community, and that communities really can have a lot of power to take care of themselves and each other.
Having mental health be accessible to everybody should be a right and something that everyone should have access to.
We know how important this work is, and I just feel so fortunate to be one person among this larger group of people who made up ReCoup, to have been able to complete this project and now look back and see the many, many spaces and the many, many ways that PM Plus is being used to support New Yorkers. I feel quite humbled to be a part of this and to witness all of this unfold over the last 5 years.